Any other questions about medicines? Yes, sorry.
I'm going through the insurance business, prior approval every time they turn around. Why, they said I have to take this medicine for the rest of my life. Why are the insurance companies really giving me a hard time about it?
I don't know, why are they giving me a hard time about it? they just, I don't know. I think insurance companies their goal in life is to say no. And then sometimes I get this great approval. You're approved for 2 years, whichever drug it is. I'm like, wait. And like 6 months later, the insurance plan changes. And you're like, here we are again. And some of the twice-a-day PPIs have only getting 6-month approvals. And we have to go back through it again. Because they want to see improvement, they want to see this, they want to see testing. So let's talk about the testing. I don't do much of the testing in my practice, but I want to talk about the testing because some people do need it. If we have you on everything and we're not getting the acid reflux better, then we do need to talk about testing, and then I want to talk about surgery that also is potential. So the first testing people usually get is called the barium swallow. Anyone here have a barium swallow? Anyone else? A couple of people? So it's a lot of fun. You have to drink some barium, and you get x-rayed quite a bit. And then what they're doing is they're watching the barium go down into your stomach and see how long it takes to empty out of your stomach. In addition, they're looking to see if some of it comes back up, if it's refluxing back up. When you do a barium swallow, you're standing up, correct? You guys stood up when you did it in front of the x-ray machines? Usually when you're having acid reflux, you're laying down. If you're standing up, gravity's pulling things through. So quite often it's not showing the reflux so much, but it can tell us if things are slow moving through. And you're there for what, 3 hours? If you're lucky, hopefully not 4, because it's taking so long for things to move through. So that's the first one, and it kind of can tell us if there's a blockage in there somewhere that's causing issues and some other things. Another test is called, the other 3 tests all go with the upper endoscopy. So the upper endoscopy is where they put the scope down into your stomach and take a look. How many people have had that? Quite a few people. And some of that's probably what you're talking about. They want to sedate you a little bit, and they're afraid of sedating people with breathing problems because, they don't want you. They want you to come out on the other side and do well, and not scare them because your oxygen levels dropped a little low. So they put the scope down. They can take a look, and that's where they look and they see if you've had that long-standing acid reflux. You see any changes that may be precancerous or cancerous. They can take a look at that. They can see if there's any other erosions in there from all the acid reflux. They can't really see reflux. They can see the results of reflux, but they can't see reflux. But when they're down there, they can do 2 things. They can do what's called manometry, which is where they measure the pressures of your esophagus. When it's doing this thing, looking to see what those pressures are. The pressure is too high and you're having these spasms all the time, or the pressure is too low where people with scleroderma just have that pipe kind of going up and down. And then the other thing is they can leave a little probe in there, a little chip that gets implanted in the esophagus for 48 hours. And then it falls off and you just pass it. And what that is, it goes with a little monitor, and that's testing the pH and how much acidity is in your esophagus. And so it's in 2 places, and they're looking to see, they know what it's supposed to be, and they're looking to see how much that changes, so therefore how much reflux is constantly coming up. So if despite everything, all the treatment, we aren't getting better, we'll send you on for one of those tests. Starting at the beginning and maybe moving on to all those tests. If you do the things with the, actually if you do any of them, you have to come off all your PPIs and your Zantac and stuff for a week. Because what we want to do is we want to see if you're refluxing. And if we're controlling it, kind of sort of, we don't get a good picture. Some people, their acid reflux is severe enough, or some people, if they want to think about surgery, lung transplant, if it's coming to that point, they may need to get what's called a Nissen wrap or a Nissen fundoplication as a surgery to try to help their acid reflux. And what they do is they take, you have the esophagus again, you have the stomach, and they take a little piece of the stomach and they wrap it around the stomach, kind of like a ponytail, kind of thing, wrap your other hair around it, wrap it tightly around it, and they suture it in to help, because that muscle's so weak, it's not closing, so they're essentially making a new muscle to hold things down here. And again, the big population that they look at it, they may not do it, but might consider it for people going for lung transplant, because they don't want you to have an acid reflux when you get a new lung. They want the new lung to be nice and healthy and to do well. So some people do have to go for that. Some people with a chronic cough have had to go and get surgery. Some people with hard control acid, we just can't control their acid reflux, may need to go and see the surgeon and have the procedure. I think that's all I had prepared, but my slides are not positive. But any other questions?
At one time, if you had trouble with food going down, they used to dilate the esophagus, which seemed wrong to me. Do they still do that?
Right, so the question is, do they ever dilate your esophagus? And yes, they do. Some people's esophaguses can become narrow for whatever reason. A lot of scarring, a lot of connective tissue diseases can cause it to happen, and that food gets stuck and they can't swallow. So they will go down for an endoscopy, and they will go down and they can stretch the esophagus a little bit.
But does that hurt the acid reflux situation, or is it involved at all?
You know, yes and no. Does it hurt the acid reflux situation? If you have food just stuck there, your stomach's constantly churning acid, trying to break it down, so that may help. Once you get the relief, you can move food through faster. Probably helps a little bit. It's probably more irritated for a while, so it may let your acid reflux kind of pop back up a little bit. But in general, people feel more comfortable after they've had their esophagus dilated. Someone else have questions? Yeah.
Yes. I got to the point where I had acid reflux every night, and I had gastric bypass surgery. Stopped it immediately.
Yeah, same kind of thing, because they're pulling everything down and tightening all those muscles and stuff with the gastric bypass.
Maybe not everybody's first idea of how to get rid of it, but worked.
Right, so it's similar to that Nissan kind of thing. And sometimes they'll do both of those procedures kind of together. Yes?
If you have a gallbladder or do not have a gallbladder, does that play a part in the acid reflux?
Yes and no. Does gallbladder play a role in acid reflux? Some, because part of what the gallbladder is doing is it's sending bile into the small intestine to help, again, break down food. So bile might be some of what's coming up into the stomach and then coming up when you're having the reflux. But you can still have acid reflux without your gallbladder. Yes?
I've taken a pantoprazole slow release once in the morning, but it doesn't quite get me through the day. Do you think it'd be okay to take 2 a day? Like once in the morning and once mid-afternoon?
Right. So most people with that, I have them take 30 minutes before breakfast and then 30 minutes before supper, but it depends on what your insurance company is going to say.
I got the pills so far.
So hopefully that will continue.
Okay, thank you.
Yes.
How important is it to pay attention to the directions on the back of, let's say you're taking Tums, you're taking Zantac, you're taking Dexilant, you're taking, 3 or 4, and the directions say don't use but for a couple of weeks, but some people keep using it longer than that, and all those at the same time on the same day.
Right. So Tums really should be short term. If someone's coming in to see me and they're telling me they're taking a lot of Tums, I know I don't have their acid reflux well controlled. Tums last for 2 to 4 hours. So you constantly have to take and replace them. So the other drugs last longer, longer acting. So Tums are okay. You've had big Thanksgiving dinner and you've had a pop of Tums. That's fine. Or you take it for the calcium kind of thing. If you take a lot of Tums, we don't have good control of the acid reflux. You don't have good control. Some people are on the PPIs and some are on the H2 blockers, the histamine blockers. They are on omeprazole twice a day, plus they're taking a Zantac. A lot of them will say take short term because the thought is that you're at a higher risk for pneumonia taking them. You're also at higher risk, we think, for actually bone loss with taking these things long term. But you're also at risk for constantly irritating your lungs if we don't have your acid reflux control. So it's kind of a mixed picture. If we can get it controlled and it stays controlled, then we can think about backing off. If you're on omeprazole twice a day plus Zantac at bedtime, and for the last 3 months your acid reflux has been doing wonderful, maybe we can back the omeprazole up to 1 set and decrease how much you're using. But always keep it in mind that we need to keep it under control to help protect your lungs. That answer your question?
It does, and then there's something that if all this acid keeps coming back into your esophagus, it strips it, or it's not good for your esophagus.
Right. Because then you get erosions, you can get those precancerous cells in there. Sometimes it's a mixed thing, but that's why it's the whole thing, not only taking medications, but elevating in bed, waiting for your last time you eat and lie down, losing weight if you need to. It's the kind of the whole picture. You have to do it all. It's kind of like people with the cholesterol pills. You take the cholesterol pills, so therefore I can eat fried chicken as much as I want. Yes.
Theoretically, a person is prone to getting pneumonia. Why would you have it on Nexium as opposed to one of the other non-PPI?
Right. So the PPIs, for the most part, work better. Zantac is good for I have a little heartburn, bothers me a little bit. That tends to work more for that. I've got acid reflux 3-4 times a week. Usually it needs a PPI.
I think this person had the high acidic reflux. What?
So what's being served back there? Chocolate ice cream? Chocolate chip cookies. I hope everybody had their chocolate chip cookie before the lecture started. Yes.
I don't know if this is a wives' tale or whatever, but someone said a good balance for acid reflux would be an ingestion of something with a vinegar mixture, like a teaspoon of vinegar, which mixed with something, and it sort of neutralizes all of that. Do you find that to be the case?
I'd have to look that up. The question was, if you take a little teaspoon of vinegar or something along those lines with something else, would that help acid reflux? And my answer probably would be, number one, my answer is I have to look that up. But I think probably it's that, again, that occasional where Tums would help or Rolaids kind of thing. The daily, I'm having acid reflux really needs to get treated more long term. Anything else? Oh, yes.
I had one doctor say one thing, he said, drink 4 glasses of cold water in the morning. That helps you better than anything.
For acid reflux or just in health?
Acid reflux.
Well, it kind of is getting things moving through, I guess. That'll make your esophagus happy, I guess. It's starting to work, moving things through for the day.
If you have erosions of your esophagus or larynx, is Nexium really work to heal that like they advertise, or is it worth the added cost for Nexium over just one of the lower cost ones? Does that really help heal anything?
So if you have esophageal erosions or a stomach ulcer, taking things like Nexium, omeprazole, Prilosec, those are the drug of choice to treat it. And people take about 3 months, it heals. Usually there's other things going on. Usually quite often a bacterial infection in your stomach, and you take Nexium in addition to 2 other pills. If it's spirit, I think it's usually more than that. That definitely is a referral to the GI doctors.